We're going to take you live now. The Health Minister, Greg Hunt, speaking in Victoria. Let's take a look.
At the Heart Foundation of Australia, Bill Trevesky, and with a very clear message. Over the last few months, Australians have done an extraordinary job in saving lives and protecting lives. They've done that by respecting each other, respecting distance, taking the difficult steps. And these steps have allowed us to get to where we are now. Today, the medical expert panel has met and Professor Murphy will provide you with an update. But there are real concerns that as we exercise our compassion and our care for each other, our concern for fair and just causes, that we do so in a safe way, not in a way which risks undoing all of the gains of the last few months. The notion that we have fundamental democratic rights is not tradable in Australia. The notion that we have care and compassion for our elders and our elderly, for Australians from all walks of life, is not tradable. But how we do it now at this moment in history, at this time in the course of the pandemic, is fundamental. We have to be safe. We cannot put at risk the lives of our police, the lives of our friends, the lives of our family, and the lives of our most vulnerable Australians, our elderly and Indigenous Australians, for whom we have fought to protect. And so our message, as people consider mass gatherings this weekend for understandable reasons of protest, is please stay safe. Do not go. Do not attend. There is a better way. Express that concern online, through donations, or with a vigil, as we did magnificently through Anzac Day. We have learnt that we can do things differently. We never trade our compassion. We never trade our democratic rights, but we have adapted, and now is the moment not to put at risk all of those hard-won gains through the COVID-19 crisis, but to consolidate them, to do what we do in a democratic way, in a respectful way, but in a safe way. And to have the medical expert panel make such a strong statement of concern as they have come out with today about the safety of a mass gathering, no matter what the purpose, is an intensely important moment for Australia, because to go backwards would put so many lives of Australians from all walks of life at risk. At the same time that we have done an incredible job in saving lives and protecting lives through the pandemic, it's critical that we continue to focus on all of the other areas of risk. And so today, I'm delighted to announce that the Australian government will contribute $29 million under the Medical Research Future Fund cardiovascular mission. And that will be for 12 projects, $11 million for 6 projects for cardiovascular disease and stroke. As an example, the University of Sydney will have $3 million to deal with post-stroke anti-inflammation research and clinical trials. This will save lives and protect lives. Equally, what we have is, for our beautiful young Australians, 2,400 children who are born with some form of congenital heart disease every year. The Heart Kids project, as part of the cardiovascular mission, will receive $18 million for 6 projects for these most vulnerable, beautiful young Australians. An example here is $3 million for the University of Queensland to deal with improving post-operative outcomes for cardiovascular surgery for these tiniest, beautiful young children. There couldn't be a more important cause or recognition of what we do through the Medical Research Future Fund. Next week, we're also likely to see additional investment through the Indigenous Health Futures program in protecting lives, in securing lives and improving the health of Indigenous Australians. As we do all of this, we're also, of course, making huge strides in protecting Australians from coronavirus. As of today, to give you a brief update on the containment process, 7,251 Australians have been diagnosed with the disease. In particular, sadly, 102 have lost their lives. There have been 11 in the last 24 hours. 10 of those have been in hotel quarantine. That just emphasises how fundamentally important the border measures are as the first limb of our containment measures. Indeed, 63% of cases within Australia across the last week have been in hotel quarantine or from overseas sources. So we're making huge progress. At the same time, our testing regime, which is now at 1.58 million tests, is an extraordinary Australian collective achievement. Australians have stepped forward, the health authorities have stepped forward, and together we have been able to achieve these test outcomes. Our tracing follows from that, and we've been able to trace those cases. But to trace a case from a mass gathering would be almost impossible. And that's why we need the COVID Safe app. Over 6.2 million downloads. But more importantly, the process of tracing within a mass gathering becomes incredibly difficult if somebody does not have the app and if there are thousands of people. That defies all of the things we've sought to do as a country. And then our last area of containment has been the isolation, the physical distancing that we've put in place. This has helped save lives and protect lives. It's been fundamental. In Indigenous Australia, in our remote communities, some of the most vulnerable people we have, as I've been advised, yet to receive a single case in our remote Indigenous communities of coronavirus. That is an extraordinary national achievement. Having said that, we are now at a very dangerous moment. We've reduced the number of people in hospital to 23, the number in ICUs to 4, and the number on ventilation to 2. To have, at this moment, a mass gathering is a very dangerous precedent. It's a dangerous step in itself, but it also sends a message across Australia. So we respect deeply people's right to express themselves. It's fundamental to who we are. We respect the compassion behind those concerns. But we say that at this moment in time, there is a better way. And that better way is what we've been able to do and what we've learnt through the whole course of the pandemic. Online statements, donations, the private vigil outside of our place of residence. These are all things that we say are available to Australians rather than coming together. There will be a time, there's always a time for protest, but it's not at this moment, not in a mass gathering form. The right to protest is fundamental. The means of coming together and risking the spread of COVID-19 is something we say to people, please think again, please do not do this, exercise your compassion, express yourself, but do it in a way which is safe, sound and respectful of our most vulnerable Australians.